Hello and welcome to EpMedic.Firstaid, channel designed to equip you with theoretical and practical skills in basic life support in first aid. My name is EpMedic. In this video, we are going to familiarize ourselves with the first aid box and its contents. With this one, we can use it in our homes, our community, and various events like sports and other gatherings. The first aid box can also be found in big buses, trains, and more commonly in industries where there are more people involved with various activities which have the potential to cause injuries. We are going to be using this first aid box in all our episodes, and each first aid box has been equipped with 20 essential items which are supposed to be found in the box, particularly this one. I'm going to be looking at each and every item one after the other, and we are going to discuss its uses and the quantity in which it is found. Now let us open the box so that we can see how the items are packed inside. We have opened the box and we are looking at the contents from the inside. This is the way they are packed. So now we are going to be getting one item after the other to talk about it, its use, and how we are going to use it in relation to our topic in discussion, which is first aid. This is a triangular bandage. It is in a triangular form. So this is the way it looks like. These come in a quantity of 18. Now, this triangular bandage, these are used to cover dressings on wounds. It is to make a sling to support the arm which has been injured, to fix splints in case of fracture, to form a tourniquet to stop bleeding. Then the last point is to apply pressure over a dressing to stop bleeding. We may also say or call it pressure bandage. These interlockable splints, they are called interlockable because, as you can see, they are pieces. This is a piece, this is a piece, and this other one is also a piece. So now they have been joined here. So you are able to join them. Let me just show you. This is the way it was joined. It has got this, where the other part is locked to. So we can lock them by fixing them like this. Now they are called interlockable in the sense that you are able to join them to the desired length. For example, let me get the other pair. So this and this have been locked. So I can get the female part and the male part, lock them together. Like that. So if this is the length that I require to use, then I can go ahead and start using this splint the way it is. Or if it is too short, I can get another piece and join it to it. So these are used to immobilize fractures on limbs. Item number 3 is surgical gloves. So this is a pair of gloves. You can put them like that. As a first aider, you must protect yourself from direct contact with blood and open body fluids. So it is very important for you to cover yourself, protect your hands, protect yourself in this way. The fourth on our list are the large dressings. These come in the quantity of 4. This is a large dressing. As you can see, they are large. So these are mostly applied on large wounds. For instance, those found along the long bones of the limbs or the trunk of the body. I mean the front part or the back part of our body. Number 5 on our list is the medium dressings. These are medium dressings. They come in a quantity of 8. So this is the way the medium dressing looks like. As you can see, the slight difference from the large dressings. So these, we can say they are slightly smaller than the large dressings. At least you can use this one on the wounds which are a bit smaller than those which we handle using the large dressings. The 6th item is the finger dressing. The finger dressings come in a quantity of 12. These are smaller enough to be applied on a finger, on one finger. The 7th item is a pair of scissors. Scissors is used to have access to the wound by cutting a piece of cloth of the injured to expose and examine it before treatment. So we used to cut a piece of cloth like that so that we can expose wound and examine it so that we can do the treatment thereafter. Item number 8 from our first aid box. These are twisting sticks. These are used mostly to make alternative bandage tourniquet in place of a rubber tourniquet when we do not have enough of them. They are used together with these bandages. This triangular bandage, we have a way of making this tourniquet. For instance, if a patient has injuries on the upper and lower limbs and they are all bleeding, we will use up the only 2 which are found in the first aid box. We have the 2 rubber tourniquets in the first aid box. So if we use up the 2 that we have on, for instance, we apply them on the upper limbs, 1 on each limb, and we need to attend to the injuries on the lower limbs as well. So for us to control bleeding, you'll need to find alternative tourniquets for the rest. So that is how we use these twisting sticks. Or to make a bandage tourniquet to be applied where the rubber tourniquet cannot be used, like injury on the upper third, that is very high up on the thigh, and we cannot use the rubber tourniquet because where we need to use the tourniquet, that's where the injury is found, somewhere around there. So we need to make a bandage tourniquet using these twisting sticks. Number 9, the rubber tourniquet, which I've just been talking about. So we have 2 of them. These are the 2 rubber tourniquets that we have. So this is how they look like, these 2 rubber tourniquets. We have this part here. This part we use to fasten. So we need to test it, test its elasticity away from the patient, because if you do it near the patient, you might lose the grip, and this is elastic. It can cause some more injuries, further injuries on the patient. There is so much to be said about the tourniquet, its precautions, advantages and disadvantages. We shall do in another video where we shall talk more about the rubber tourniquet and the bandage tourniquet, even the alternative tourniquets that we can use if we find ourselves where there are no triangular bandages, there are no rubber tourniquets. We can still have a way to make a tourniquet. Well, if you want to continue watching our video on first aid, please click on that subscription button or like this video so that I get encouraged to do more. The number 10 item is the cotton wool. The total amount of 400 grams. This is the soft white stuff that is applied on top of the dressing to absorb the blood that will likely be coming out as we transport our patients to the hospital. So this is how it looks like. You can see it's so soft. So we apply this one on top of a dressing. After we dress the wound, we put this thing on top of the dressing so that whatever blood that will still be coming out will be absorbed by this cotton wool. These are splint paddings. You can see the material looks more or less like the one that we were looking at, the cotton wool. They are used as cushion when splints are applied in case of fracture. More padding should be applied where the bone is fractured and where the bones are more prominent, like the knees and ankles, to reduce the pain or friction. They come in a quantity of 500, so you may need more of these things so that you may lessen the pain on a part where the patient has been injured. Now this is the white lint. This is the material that is used to make white lint. So they come in a quantity of 4. There are 4 of them. So this white lint is a special material. It is used on wounds caused by burns. If our skin is exposed to heat or burns, open flame or fluids, anything that causes our skin to be burned. So to cover such kind of wounds, we use this white lint. We also use it on peppered wounds. A patient who has been exposed to an environment where there were explosives or there was a bomb, and those peppered wounds are caused by flying objects, the stones which come, many of them, and then they make wounds either on the face. So we use white lint to cover the face. We also use these white lint to cover the protruding bowels of on the abdomen. 13 on our items. These are crepe bandages. They come in a quantity of 4. As you can see, there are 4 of them. Now, with these are the ones we are so familiar with because they are used mainly by footballers. Let me open one of them so that we can have a look at the way they look like. This is a crepe bandage. So these are just the pins to hold them together. So this is the way it looks like. As you can see, it's elastic. You are familiar with these because they are mostly used by a lot of people, the sportsmen, footballers, and the others. So now in this first aid box, these elastic rolls of bandages we use in first aid when a patient has been bitten by a snake, either on the upper limb, the arm, or on the lower limb. We use this type of bandages to roll it, to apply it across all the entire limb so that we can slow down the movement of poison so it does not go faster to the heart and other parts of the body. So the 14th, this is a safety pin. These are safety pins, simple as they may look. These are very important. They come in a quantity of 12. They are used to fasten bandages. 15 on the list of our items that we have in the first aid box is BANDAGE. They come in a quantity of 4 packets, as you can see. So there is a lotion inside of this packet. So this is an ointment used to apply on wounds caused by burns as a pain reliever. So it relieves pain when you apply on a patient who has just been burnt. You just apply it, you cut it, that lotion which is found inside, you apply it on the wound. There will be a bit of some relief on that wound, and you do the treatment, and that's when you transport the patient to the hospital so that they do the rest of the medical treatment on that wound. This is a cervical collar. Cervical collar is very common. You see it in patients with a stiff neck. They use these things more often. So in first aid, we use this cervical collar. It's very important. It must be found in the first aid. It's an instrument used to immobilize the spine on the back of the neck. So if the patient has been found in an accident, more especially those that involve collision or a fall from a height, and it was an impact, Before we can handle the patient, we have to make sure that the neck of the patient has been immobilized. It is not moving from one end to the other. We need to apply this cervical collar. This cervical collar comes in a quantity of 1. We have 1 in the first aid box. We can even have more than this, but this is the minimum that we have in the first aid box. The 17th item on our list is the C.P.R mouthpiece. They come in a quantity of 2. There's one end which faces the patient and the other one where the first aid is supposed to be facing. So it is for single use only. So this side must be up. This side must be up. It is the one the first aider uses to blow air, and this is the side which must be down. This side it must face the patient. So now the C.P.R is an instrument used when administering artificial respiration from the mouth of the first aider to the mouth of the patient. So the essence is to avoid mouth-to-mouth contact, and it has a one-way valve which does not allow air to flow back from the patient to the first aider. So it is a safety way of administering artificial respiration to a patient who needs air. So as we administer that air into that patient, that air will not come back to us as if because there's a valve inside, just there, that's by the neck. As you can see, there's a valve. Number 18, the strip plaster. These are the strip plasters that you are seeing here. This is just one of them that I've removed, this one. So this is the way it looks like. This is one of them. So now these strip plasters are used, or they are applied on small wounds. We normally see if a patient has got maybe a cut on the face, just very small cut, we see them with the plasters on the face, on the arm, anywhere where there is a very small injury or where there is a very small wound, we can apply these strip plasters. So they come in a quantity of 30. Number 19 on our list is GOOSE SWAB. This is a packet of GOOSE SWAB. So this is what is found inside. This is one of them, as you can see. So this is called GOOSE SWAB. It comes in a quantity of 1 packet. So this is the material used to clean or wipe dirt around and away from the wound. We use this when a patient has just been injured and we need to clean the wound. We will need this material to clean dirt around and away from the wound. So now, lastly but not the least, what you are seeing here, these are the 3 types of fluids that were in the first aid box. Now on our list, what is very important, we need to have this liquid. This is normal saline. We only need the normal saline in the first aid box. So now this normal saline, this is the fluid used to wash the wound. It is made of salt and water. This is what we are going to be using in our episodes. We are going to be using normal saline. And so besides the 20 items that we discussed, the essential items which are found in the first aid box, there are some other instruments which you may need to have. The other important items are the ambi bag. The ambi bag is an instrument used to administer artificial respiration like the C.P.R, but this one, it is easy to use in all cases, including a patient exposed to gases. It is not stressful as compared to other methods of artificial respiration. Then the other item that you need to have is a shock blanket. You need at least a minimum of 2 blankets. This is a normal blanket used to cover the patient lightly for the treatment of shock. You realize that after an accident, most of the patients go into shock, and we need to treat it so that that patient does not deteriorate. The other instrument or the other item is a stretcher. You need at least a clinical stretcher or a stretcher that you may use to transport a patient. So this is the means in which a patient is transported safely and securely on a stretcher without having to move the patient unnecessarily. Now, with this first aid box and its contents and the other instruments, you can attend to almost all cases of injuries and probably help save a life as a first aider. It is therefore important to acquire a skill to know how to attend to the accident victims and help transport them to the hospital for further medical treatment. Well, this is what we had for you. Look out for more videos by pressing on that subscription button so that you get notifications, or like us by giving a thumbs up or a thumbs down. That depends on you. You can also leave a comment down there and I'll try to answer all the questions that will be posted. Thank you very much.